patients that I see are usually critically ill. Either they need an emergency operation or they're facing a life-threatening disease such as lung cancer or heart disease. And oftentimes it's difficult to explain the detail of the operation in terms that they'll understand. And I try to explain things as I would to a family member. I try to treat that person in a way that I would hope someone would treat somebody in my family in that situation. I try to spend extra time to explain things to patients, show them the images that we have, x-rays or catheterization films, and put it in terms that they understand, so I can reassure them that I understand their problem, I know how to treat it, and we'll get the best outcome we can for them. Medicine in general terms, because I've always enjoyed the sciences, but also was looking for a career that involved interaction with people. So it was a perfect marriage between science and sort of that aspect of medicine. Really, heart surgery, I didn't make that decision until after I had been in surgical training for quite some time. I find it's one of the more challenging fields technically, and some of the most rewarding. You can take somebody who's critically ill and with a well-executed operation put their life back on the right track. The person who had the biggest influence on me has been my father. He worked as a public servant, as a police officer, and had a lot of influence on me completing my education, and knew the importance of an educational background. So I think he had the biggest influence on me. The reason we wound up here is because my wife had worked at Mother Francis at one point during her career as a nurse, and when it came time for me to find a job, she suggested we look into Tyler, and we've been here ever since. It's a great community to raise children. People are very friendly. That's probably the first comment that I hear most when I have family members visit from out of state, how nice everyone is, how friendly East Texas is.